today, Johnson gave his third prime ministerial address to the nation. The first was back in March to announce the start of the lockdown. The second was in May, where Johnson ended the lockdown while telling us to stay alert. No one really understood what it meant. In tonight's speech, Johnson started by laying out the danger of a second spike, and guess who he blamed for the increasing cases? Let's take a look.
When the sickness took hold in this country in March, we pulled together in a spirit of national sacrifice and community. We followed the guidance to the letter. We stayed at home, protected the NHS, and saved thousands of lives. And for months, with those disciplines of social distancing, we've kept that virus at bay. But we have to acknowledge that this is a great and freedom-loving country, and while the vast majority have complied with the rules, there have been too many breaches, too many opportunities for our invisible enemy to slip through undetected. The virus has started to spread again in an exponential way.
We're in troubled territories, but whose fault is it? It's not the fault of the government for paying billions of pounds to Serco for a test and trace system that doesn't work. It's not the fault of the government for bullying us back into our workplaces when it was entirely unnecessary. And it's not the fault of the government for giving everyone cut-price meals to go crowd into pubs and restaurants throughout the summer when we should have been preparing for the second spike. No, it's the problem of the British public breaking the rules. Anyway, because of these dastardly members of the public who are not following the rules properly, we'll have some new restrictions in place this week. Let's take a look at Johnson, list through them.
So today I set out a package of tougher measures in England. Early closing for pubs, bars, table service only, closing businesses that are not COVID secure, expanding the use of face coverings, new fines for those that fail to comply, once again asking office workers to work from home if they can, while enforcing the rule of 6 indoors and outdoors. A tougher package of national measures combined with the potential for tougher local restrictions for areas already in lockdown.
So the restrictions there, we're going to go into those in a bit more detail in a moment. But first of all, I want to run you through what happened for the rest of the speech. So after listing out what would need to change, probably the most politically interesting move, actually, was him sort of talking down the naysayers on his backbenchers. So he sort of put to bed some right-wing talking points about the fact that were suggesting, people like Julia Hartley-Brewer, in fact, who are suggesting that we don't need new measures, we should just let the virus run through the population, Sweden-style, go back to the herd immunity strategy that they had adopted at the start of March. Let's take a look.
And to those who say, we don't need this stuff, and we should leave people to take their own risks, I say these risks are not our own. The tragic reality of having COVID is that your mild cough can be someone else's death knell. And as for the suggestion that we should simply lock up the elderly and the vulnerable, with all the suffering that would entail, I must tell you that this is just not realistic. Because if you let the virus rip through the rest of the population, it would inevitably find its way through to the elderly as well, and in much greater numbers.
So that was Boris Johnson there. I agree with him there. He is talking down some voices on his backbenches that are saying, let's adopt a herd immunity strategy. We'll just lock up the elderly. Basically, what we were describing back in March and what we were opposing while the government was still adopting it, and why Britain had so many deaths, because the strategy which Boris Johnson there is rightly saying is the wrong one. You can't just allow coronavirus to run through, for example, the younger sections of the population and assume it will never get to the older sections. That's what happened back in March in this country. It's what happened in Sweden through much of the first half of the year earlier on. He's saying we're not going to go down that route, and we are still going to continue trying to suppress the virus. So, one thing I agree with the guy on there. Let's look at some of these measures, Aaron. I want to see if you think they're sufficient. So the changes which have been announced after a... No. Okay, yeah. So the biggest U-turn is telling people that they're going to have to go back in... or they're going to have to stay at home, work from home if you can, wherever possible. The other one, table service in hospitality, although I already thought that had been implemented. So I'm slightly unclear about what's changed here. I think maybe it's now illegal to not do table service, whereas before it was just recommended. and a 10 p.m. curfew for pubs and restaurants. Workers in hospitality and retail will now have to wear masks. Before it was just customers, and weddings will be restricted to 15 guests, and before now it had been 30. And he is suggesting that this will all be in place for around 6 months. Aaron, do you feel more confident now that we are not going to go back into the kind of spike that we saw at the start of this year?
I mean, are we not? Is that not happening? I mean, that's basically what he implied. He said we're now, we can't deny the reality of what he called it, basically this logarithmic function, exponential growth. He said that's what's happening. I mean, this may stop it. I mean, that's the intention, but it's not. I mean, who says it will?
Yeah, well, I mean, even so, I mean, we're not in a position that we were in the start of the year, really. I mean, one, because we do have a bit more preparation in terms of like the PPE they have in hospitals. We know a bit more how to treat it. We're not going to see the same, right? We're not going to see thousands of deaths.
Why not?
A day.
Why not? It's asymptomatic in 40% of people, and we don't. If we had an effective test and trace system, I agree, but we don't. And as we saw in Bolton, one person, he would have created basically a huge outbreak across the city. You can foresee how that would work in every town and city in the country. Without effective test and trace, we can't have anything like returning to normality. That's my view. No, we won't have 1,000 deaths a day. We could have several hundred deaths a day for sure. Yeah.
Yeah, I mean, I suppose what I'd say is the big difference between now and then. So one, even though the preparations for test and trace have been pretty appalling, we're still doing way more tests than we were doing at the start of the year.
Yeah.
The preparation is better, even if the government's handling of it has been completely cat-handed. But more importantly than that, I think, when we saw that huge, thousands of deaths a day in the UK at the start of the year, those were principally from people who had caught the virus before we even really knew what was going on, or while the government was still telling us this isn't that much of a big deal. People have changed their behaviour, and I think it was Neil Ferguson who said this on the radio the other day. No, it was John Edmonds, who's someone who sat on stage, and he was asked, will we see a second wave similar to the first? And he said, no, but the only reason is because he doesn't think we'll make the same catastrophic mistake we made last time, which is to see cases rising in such a way and not take extra measures. I mean, also in terms of, are we in the same position as we were at the start of the year? Then we were seeing cases doubling every 2 to 3 days. Now it's every week. So, there are differences.
I don't think we're totally unprepared. Yeah, but the point is as well, that was a crisis which ultimately was resolved by freezing, completely demobilizing society. If we're not going to do that, and we're going to basically go to some sort of steady state of quite bad, but not quite as bad, I mean, what's that going to look like? Is it going to look like 400 or 500 deaths a day? Because like I say, you've got 40% of people who are asymptomatic. I think this is something we really, really have to think about. The long incubation period, the fact that most people don't exhibit these symptoms. If you have kids going back to school, if we have open borders, people traveling, I think it's remarkable that people are traveling in and out of the country, personally. And I said that at the beginning of this, and some people criticised me. People have to go and meet their families and so on. Fine, you have extenuating circumstances. But the fact we have people, travelling abroad, it's remarkable.
Yeah, well, I mean, again, the whole travelling is because people are moving. I mean, again, I feel like that policy actually kind of makes sense. People are going to countries with a similar level of COVID to which we have. I think probably the bigger problem, as opposed to people going abroad, is people going on holidays. It's the kind of socialising which they actively encouraged, which is to say, go out and support hospitality. Spain, one of the reasons why Spain is so badly hit is because their economy is a bit more reliant on tourism. So what they said is, we need to open even nightclubs. This idea that in that summer we pushed people back into enclosed spaces where people speak loudly and drink alcohol seems ridiculous at this point. It's going to go down in history as one of the most embarrassing, catastrophic, unforced errors in governance in decades, I think. Let's talk about some of the specific policies, though. I mean, what do you think about the 10 p.m. curfew? We'll go through some of them. Does it make sense?
Pissing in the wind.
You think?
Pissing in the wind, yeah.
Yeah.
Pissing in the wind. I mean, what are the primary vectors of this thing? It's going to be kids at school. It's going to be care homes. It's going to be large workplaces. Pubs. Okay, yeah. But I don't think it's not definitive.
Well, I don't think they are suggesting that schools and
pubs are still going to be open. And by the way, you only have table service. What if I can't? What if I have a complaint? Am I not allowed to go to the bar? If I go to the bar, will I be fined £10,000? I mean, come on. There's going to be so much. As with all rules, it's about enforcement, and a lot of this won't be enforced, regardless of what the government says.
I mean, I'd push back about that again, to be honest, because with all of these rules, you don't need 100% of people to follow them all the time. If you have, 1 in 100 people who has to go up to the bar because, someone on their table's having an anaphylactic shock or something, that doesn't undermine the whole system because you're still reducing contact at the bar by 99%. So I don't think we can, say these policies are meaningless or pointless because they will sometimes be broken.
I said that specifically in regards to the 10 p.m. curfew. They're two separate points you're making there.
Well,
I'm not saying the 10 p.m. curfew will be sometimes broken, therefore it's redundant. I'm saying the 10 p.m. curfew is pissing.
You're saying that about table service?
Yeah, it's a separate point.
No,
but the original question was about the curfew, and I'm saying,
Okay.
and the curfew in regards to the curfew is pissing in the wind because pubs close at 10 rather than 11. There'll be a rush to leave. Are people going to drink? People might drink 95% the volume of alcohol, despite the time being less because they're sort of binge drinking as you get final orders in and so on. All of this is, as I'm sure we agree, all of this is entirely secondary to having an effective test and trace program. If you have that, you can do loads of this stuff, right? But it's like I said it before, I'll say it again. 4 words, pissing in the wind.
I mean, in terms of pissing in the wind, yeah. I mean, I think the 10 p.m. curfew probably makes,
it'll help 1%. Hey, it's not going to hurt. It's not a bad thing, but.
Let's go to this particular issue, which I think is, again, a completely embarrassing policy failure, which is that the government spent the entire summer bullying us to get back into work. I mean, in case you'd forgotten about this, we can get up some headlines for you from over the summer. Can we get some of these up? So we've got there, the Daily Telegraph. Go back to work or risk losing your job. And that's from ministers. Boris Johnson to roll out major campaign to get Brits back to office amid ghost town fears. So you've got here loads of pressure coming from politicians, from Boris Johnson and from his fans in the press to get you back into the office. Today, the government have had to do a screeching U-turn. They said, no, actually, if you can work from home. We've been saying it all summer, but they've only just realised it now. We're going to go to another clip now because this was put to Michael Gove this morning on the BBC.
Boris Johnson told us back in July, didn't he? He said, start to go back to work now if you can. Is that still the message?
No. One of the things that we do want to stress is that there are some people who cannot work from home, and we are very clear that in a COVID-secure and a safe workplace, if your job requires it, you should absolutely be in that workplace. But if you can work from home, then that is something that we support.
So that's what a complete about turn, isn't it?
No, it's a response to the spread of the virus. One of the things that Professor Vance and Chris Whitty pointed out yesterday is that if we look at the trajectory of the virus, then we need to take action now. And a stitch in time saves 9. If we take this action at this point, then we can hopefully avert more serious action later.
So just be really clear, if you don't have to go back to work, the message now is don't do that.
Yes, if people can work from home, they should. But I stress that it's very important that those people whose jobs require them to be in a specific workplace do so. So again, we're not revisiting the days at the beginning of our response to this virus. What we are doing is saying that there are now steps that we've taken in order to make workplaces safer for everyone. Those steps have been taken in consultation with businesses and trade unions. We know what they are. Workplaces are safer, but one of the risks that we have to face is that social mixing overall contributes to the spread of the virus. So as much as we can restrain that as possible at this stage, the better for all of us.
It's not a U-turn. When the facts change, the policy changes. And because the virus is spreading now more rapidly, we've had to change the policy. Instead of saying, it's your national duty to go back into the workplace to save our landlord mates and various sandwich chains, now they're saying, go home if you can, work from home if you can. The problem with that argument, though, is that the change of the facts is not independent from the policy that they had before. So they can't say, we told you to go into work when there wasn't a virus, and now the virus is spreading, we're telling you to work from home if you can. Why is the virus in much higher circulation than it was before? Because you told everyone to go back into their offices. And there's also indirect effects, right? Because it's not just the effect of telling people that it's their national duty to go back into their offices to work doesn't just create new infections in offices. It also creates a culture and an environment where people feel like, oh, everything's fine. We're being told that it's our duty to go out and do the same kind of interactions that we have been doing, our whole lives. And now the government's saying, suddenly, the facts have changed now. The facts changed because you had a ridiculous policy that everyone could see at the time was ridiculous. Although I suppose the Labour Party didn't say anything about it. But we'll get onto that later.
The Labour Party are, entirely complicit, aren't they?
Because they were on this question, absolutely.
Because you're saying workplace, but also schools. And I'm not saying we shouldn't have reopened schools. I think it's very noble to say the priority here should be reopening schools. I agree. But it clearly should have had far more thought and resources put into it. Why couldn't we have had schools similar to what happened with the pop-up hospitals? Why couldn't we have said we're going to half class sizes, et cetera, et cetera? I still think this would have happened, by the way, as I just said to you. I think it's all kind of academic and speculative until you have test and trace, but it certainly wouldn't have increased this quickly. We said on Monday, why isn't half term 2 weeks rather than one? Really easy thing. Why don't we have a 4-day week? Why haven't we had a national plan for remote working and so on and so forth? So, has the government been advising businesses about how they can project manage in such a way as that more and more people are working out of the office? Have they spoken to construction businesses about how they can work in such a way to minimise contact between workers? No, and partly, of course, you have to blame the government. But like I say, Labour have been deeply complicit in this. 6 weeks ago, Keir Starmer was saying that when kids go back to schools, they shouldn't be wearing masks. It's unreal. And at the time, I said, remember the day. This is unbelievable. In a month or two, they're going to be regretting saying this, and it won't be policy anymore. And lo and behold, that's where we are.
We're going to go to another clip. Aaron has rightly been bringing up the failure of test and trace as one of the reasons why we are in this mess, even though Boris Johnson wants to blame you guys. This was brought up by Labour MPs multiple times in Parliament today. This is, as we've said before, one of the things they have felt comfortable opposing the government on, which is their failures of test and trace when it comes to going back to work. They've sat on their hands. They'll agree with whatever the government says. On this one, no. And Boris Johnson's responses today in Parliament were pretty poor, to say the least. Let's look at him answering one question about the failures of test and trace.
Sadly, the reason we are facing greater restrictions is because the government have failed to establish an effective testing system. My constituent was not able to access a test for her son, sent home from school and asked to travel 300 miles for a test. Despite the fact I raised this case in this chamber last week and received assurances from the Health Secretary, she still can't get a test and she still has had no contact. Prime Minister, when will you fix the testing system?
Mr. Speaker, I increasingly think it's disgraceful that the Labour opposition continue to blame NHS test and trace for the resurgence of the disease. I really think that is because there is a complete hiatus in their logic. There is a complete hiatus in their logic. They're talking absolute nonsense. It is not testing and tracing has very little or nothing to do with the spread or the transmission of the disease. The spread of the transmission of the disease is caused by contact between human beings and all the things that we're trying to minimize. And that is why, of course, NHS test and trace is vital. But the way to fix the problem now is for the whole country to follow this package of guidance, drive the R down, and allow both education and the economy to continue. But there is a complete flaw in their logic.
This guy's been in charge of pandemic response for 6 months. I mean, he should take the disease seriously because it nearly killed him. And he has been having, weekly meetings with the chief medical officer and the chief scientific officer, the best scientists in the land. And he still stands up in Parliament and says, oh, no, the spread of the disease has nothing to do with the effectiveness of a test and trace system. I mean, he's saying their logic is faulty. You ask sort of 90% of the public, people who don't have weekly meetings with the best scientists in the country, and they can explain people who need to reduce their contacts with other people will know. They'll know if they have the disease, and they'll know if they've been in contact with someone who has the virus. So yes, I mean, I can't believe I even have to say this. Yes, an effective test and trace system would help us reduce coronavirus cases. And he's the Prime Minister. He stood up in Parliament today and said it wouldn't. It's bizarre. He had a different, equally stupid answer to a similar question from Labour MP Ben Bradshaw. Let's take a look.
Does he think that the reason Germany and Italy have far lower COVID rates than us, with life continuing more or less normally, might be because they have locally and publicly run test and trace services that actually work.
No, Mr. Speaker, I don't. And I think the continual attacks on local test and trace and what the NHS test and trace have done are undermining and unnecessary. And actually, there is an important difference between our country and many other countries around the world, and that is our country is a freedom-loving country, Mr. Speaker. And if you look at the history of this country over the last 300 years, virtually every advance from free speech to democracy has come from this country. And it is very difficult to ask the British population uniformly to obey guidelines in the way that it is necessary. What we're saying today is that collectively, and I'm answering his question directly, collectively, the way to do this is for us all to follow the guidelines, which we will strictly enforce and get the R down. That's the way forward.
So the problem with that argument, obviously on the face of it, it's stupid. I'm sure none of you found it particularly convincing to begin with. But it's also just false. Social scientifically, it's false. They did surveys of many people across European societies. Britain was one of the most pro-lockdown countries of any of them, and the most supportive of following rules and regulations. There was some good, I should have put them in there actually, some good surveys tweeted by Sundar Katwala today showing that Britain is, in fact, the most supportive of following the rules when it comes to these particular issues. I remember we were told this over and over again, actually, when the lockdown first came in place, when we had Chris Whitty and Patrick Vallance standing up in front of the population and saying, one thing that's really promising, one thing that's really good is the British people are following these rules very closely. You know, we saw the graphs. We saw how much use of public transport fell. We saw how much contact between people was falling. The British people did their bit. They did the lockdown properly. The people who didn't do their bit was the government, and partly because the British government told us, oh, you're doing too much social distancing now. You know, our mates who owns office spaces, they're struggling. Could you just mingle a bit more? Right? And then people did mingle a bit more because they did what they were told. And now suddenly he's not saying it's their fault. He's saying they did it because they were freedom loving, whereas they actually just did it because the government told them to.
I mean, can you imagine being on your deathbed in hospital and you pull the oxygen mask away from your face and you just go, I love freedom so much. And you put it back. And what's it? I mean, this sort of boils down to the fact that a lot of Tories basically think that Britain is a crap version of America. I always thought Brits were famous for liking rules. I always thought, and by the way, that was borne out, like you say, in the social scientific data from the last 6 months in terms of how the public responded to the lockdown. I always thought they liked these rules and queuing and all these arbitrary conventions that basically make them behave in certain ways. Very different in the American continent, of course. There's always new land. If you screwed up, you can always go west. There's always a new frontier. You can always renew yourself. Britain is a small country. It's a very different sort of sociological subject that it creates. So utterly absurd. Only Boris Johnson could somehow turn 50,000 deaths and an utter mismanagement of a pandemic into somehow an occasion for national brouhaha. Who else could do it? In fairness to the man, who else would have the temerity, the martsy, the front to somehow say 50,000 people have died because they loved freedom so much? God bless their souls. God bless this country, and God save the Queen. I mean, I feel like we're living in a cartoon. I do. I feel like we're living in a cartoon. 50,000 people died because they love freedom so much.